Good afternoon, everybody. My name is Dr. Karen Begg. I'm the Deputy Dean of Undergraduate Education at the Faculty of Health Sciences. And this session is going to be discussing the MBChB or medicine degree. And there are a few of us who are presenting. I'm presenting on behalf of the program convener, Dr. Petula Wickham, who isn't able to join us this afternoon. And I'm just going to be taking you through a little bit about the nuts and bolts of the MBChB degree. So first of all, to become a doctor, you need to complete what's called the MBChB degree. And the reason that it sounds a bit complicated is that there are essentially two bachelor's degrees together. So it's a Bachelor of Medicine and a Bachelor of Surgery. It's a 6-year program versus most of the other bachelor's degrees are either 3 years or 4 years. Because this is essentially two bachelor's degrees together, it's a 6-year program. There are a total of 230 places available in first year. It's very competitive. Our admission criteria for 2021 are based on the NSC results and exclude the NBTs. For conditional offers, we're using grade 11 results, and those conditional offers are being sent out currently. So our aim is to produce a generalist health professional who is capable of providing healthcare in a decentralized health system that is South Africa, who is imbued with a spirit of inquiry and who's committed to the principles of equality and social justice embodied in the primary healthcare approach. So the curriculum goals are around professional values, attitudes, behavior and ethics, a scientific foundation of health sciences, communication skills, population and health systems, clinical skills, management of information, critical thinking and research. And how the program works is that you start off in first year looking at some basic sciences, basic health sciences and psychosocial sciences, as well as becoming a professional. Second year moves on to a building on top of that called integrated health sciences, and then as well as the second part of becoming a health professional. The second year and third year then start to look at integrated health systems, looking at family medicine, psychosocial sciences, primary health care and public health, becoming a doctor, looking at clinical skills and communication and languages, as well as then the introduction to clinical practice. This is the first time that you will start engaging with patients and simulation laboratories. We also have a special studies module where you'd be able to choose something of your own choice that you'd like to be able to do either in research or in other areas. In your fourth year, you'll then start with clinical clerkships. So essentially from now on, the medical student is no longer sitting in lectures at any point in time and is really rotating through. So at this point, you stop being a single class and you move into block systems. And one person might start with psychiatry and another person would start with a group in anesthesiology, and you move through these disciplines of obstetrics, medicine, pharmacology, therapeutics, neonatology, and health in context. Fifth year then follows the same format with many more surgical disciplines, as well as some combined disciplines. This is the time when you'll have opportunity to spend time in the trauma unit. And I did miss saying that you'll be delivering babies in the fourth year, which is a significant highlight. In sixth year, we then consolidate and really bring all of the things that we've learned over the fourth and fifth year together and help you be ready to then emerge as a doctor, ready for independent practice under supervision as an intern, followed by a community service medical officer. So on qualifying, you'll need to register with the Health Professions Council of South Africa. You would go through 2 years of internship and 1 year's community service. Those are placements by the Department of Health, and you are paid a salary during these 3 years. Following that, you're able to work as a medical officer in a hospital, in a clinic, or an NGO, or be a GP in a private practice, or a doctor in industry. You can teach in academia, you could upskill yourself with postgraduate diplomas, or you could study further to become a specialist, which could take another 4 to 7 years, a subspecialist, which is another 2 to 3 years on top of the specialization, or you could choose to move into research. And there are many other options. Why UCT? Well, because we look at more than knowledge and more than skills. We ensure that you focus on graduate attributes and that we focus on your becoming a professional. So we really encourage you to become a healthcare superhero and to choose UCT. And so I'm going to end off there and hand over to my colleague.
Hi, good day, everyone. My name is Marvin Janssen. I'm a lecturer in the Clinical Skills Center. And I thought it would just be important to give you an overview of how UCT handles clinical skills training. So I'm just going to give you a brief overview of what the skills entail and how we facilitate your clinical skills training throughout the years. Okay, so we can go to the first slide. So the mission of the Clinical Skills Center really is to facilitate the learning of the essential clinical skills, which are vast throughout the Faculty of Health Sciences. So we service health and rehab as well as medical students, and there would be occasions where you're actually doing skills together because interprofessional training is quite important. We can move on to the next slide. Okay, so the structure that we have adopted at UCT is to look at, there are three main components that we use to facilitate this process. Number one, we've got highly skilled educators, and these comprise of doctors, which are working in various hospitals. It comprises of nursing staff and other allied services such as paramedic staff, etc. The second component that's very important is our equipment and facilities. So we've really invested quite a lot of money and resources to ensure that our simulation equipment is state of the art and the best out there. Coupled to that are facilities that are really accessible and really make the environment very conducive to learning. But to ensure that all of this works, we do need a motivated student body. Over the years, that hasn't really been too challenging because it is a very fun environment to work in the Clinical Skills Center because you will be interacting with various equipment and various other students, etc. Okay, next slide. So you might ask yourself, why simulation? Why can't we just go out there and practice on real patients? But that is where the problem lies. Ethically, it's not acceptable to practice on patients until you have been found competent. So we really want to ensure that our students are comfortable when they enter the clinical environment and that they've really been trained adequately and they feel comfortable to actually do the skills that are sometimes very invasive. So that's the first and the most important reason why simulation is so important throughout the clinical skills development. Secondly, you can go to the next slide. We know and we appreciate that students develop at a different pace. So what simulation affords us is that we can really individualize the teaching that we provide to our students. So you as a student might not get it the first time. And the challenge with the clinical environment is that it's really dependent on the availability of patients. So in the simulated environment, we can develop and we can design a curriculum where you are able to access the Clinical Skills Center at any time. So you can come in, maybe not have gotten it the first time, but you are able to practice that skill repetitively until you feel comfortable and until you then have the prerequisite knowledge and skill to do that skills in the clinical environment. Okay, next. So what to expect? Many of you might have seen some simulation models on Grey's Anatomy, etc. So that is really what you're going to be exposed to when you enter the UCT Clinical Skills Center. Like I said, our equipment is state of the art, best and the most innovative. And then also, like I said, but it cannot be without our highly skilled educators. So the model that we have is different departments, whether it is obs and gynae, whether it is whatever, will provide the trainers, and then we provide the equipment for you to perform and you to do your skills. Next slide. The last slide that I want to speak about is just what to expect in first year. So first year is really just going to be an introduction to clinical skills and simulation. So we're going to do a bit of a first aid course, and then we're going to just make sure that you have some basic skills, and then after that we will go into the more in-depth when you reach third year. So I'm going to hand over to Dr. Jacob, who will just give further insight as to what to expect.
Good afternoon, ladies and gentlemen. I am Dr. Nisha Jacob, and I'm a public health physician at UCT. I happen to be an alumnus of UCT, having done both my undergraduate medical degree and postgraduate specialization at UCT, and I currently convene one of the fourth-year medicine courses, as well as lecture medical students in second, fourth, and sixth year. So a very long time ago, I was in matric wondering if I should pursue a career in law, as I enjoyed debating, a career in actuarial sciences, as I like numbers, or a career in medicine. And ultimately, it was a desire to interact with people on a personal level that led me to medicine, with a touch of the attraction from the glamorous side of medicine so often portrayed on TV. So I entered medicine at UCT when the university had just introduced the new curriculum of integrated problem-based learning, which continues to be taught at present. So while we expected the typical exciting features of medical school, such as anatomy, dissection, and much more, we were quite enlightened when that emphasis was placed on health being more than just the physical well-being of an individual. So from year one, real patient cases were used to illustrate how various disciplines integrate in the evaluation and management of patients, rooted in the primary healthcare philosophy. We learned that treating a patient was not the only role of a doctor, but understanding the patient holistically from a biosocial perspective, preventing disease, and understanding how society works, quantifying health problems statistically, and advocating for a better society were also within the scope of a healthcare professional. And so I was pleasantly surprised that my interest in both debating and numbers still had a role to play in a future career as a doctor. From year 3 onwards, more time was spent in the clinical environment, where we continued the privilege of being taught by the brightest minds in the world, as well as the opportunity to immerse ourselves in communities, understand their context, and attempt to address issues in collaboration with community members. So this newspaper article illustrates the opportunities we were given even way back then to learn and practice these skills as students, and then use them in our internship and community service. And these experiences later inspired me to pursue a specialization in public health at UCT. And this passion that was nurtured in my undergrad years is essentially what led me back to UCT, in a position where my colleagues and I hope to mold future doctors who see the bigger picture and understand the social determinants of health and our history, our leaders who work to improve the health system and practice evidence-based medicine. But in order to mold these kind of doctors, we as educators aspire to be understanding, responsive, and humble role models who teach with passion. So I'm privileged now to be able to work with many of my own mentors from my undergraduate years who continue to inspire me. And perhaps the sense of support, belonging, and family is the greatest gift that UCT can give both as students and staff members. And it is with great pride that we as educators see the work that our students continue to do in our communities, even in the midst of this global pandemic. So this is an article of a recent project that our fourth-year medical students embarked upon relating to the COVID pandemic. And earlier this year, I was involved in preparing our students to return to the clinical platform in a time of COVID. And we were really amazed at the resilience and fortitude shown by both staff and students in adapting, in being flexible, and managing this pandemic to the best of their abilities. So we hope to continue to nurture and mold many more young minds into compassionate, clinically competent, and socially accountable professionals, and forever members of the UCT family. But I do think that the best way to understand the current student experience is to hear from the students themselves. So I hand over to our current students, Sinalo and Lupolo.
Good evening, everyone. I'm Sinalo Nyagambi.
And I am Lupolo Mdolo. and we are third-year medical students, and we would like to share a young presentation with you that we formulated together just to help students out there who are willing and keen on coming to UCT to understand the reality versus the expectation, and also just to answer a few questions that they might have. So without further ado, should we? We'll just share this video.
Hello everyone, my name is Lotolomito.
Hello everyone, my name is Nalineka.
We are third year medical students. My impression of UCT and MBChB was a bit scary at first when I arrived, because I realized the magnitude of respect and love people have for this degree. And now I'm going to be part of those people, and I'm going to be working with those people, and I'm going to be developed by one of the best universities in Africa. So to me this was major, and coming from a small township, this to me was mind-blowing. But when I arrived here, I started to feel like I belong. Looking at the caliber of students that were here in my class, I just started to feel overwhelmed.
So my first impression of UCT and MBChB was, wow. That's all I could think. I just think like, wow, I'm finally home. And I know that sounds cheesy, but I felt as though all my wildest dreams were coming true. I felt like I was finally somewhere where I belong. And it was mind-blowing for me to see so many different people from so many different backgrounds in one place. And I was just excited to see how this new journey, or where this new journey was going to take me.
One thing I wish I was told when I came to university is that you should learn how to learn. Because when you come here, it's not the same, but you learn. And it is to understand yourself. What type of student are you, right? What are your goals? What are your dreams, right? Identify yourself. Learn what works for you. Because that is when you will start reaching your full potential. Because when I came here, the only thing that I wanted to do was to reach my full potential with this maximum amount of resources that you may have.
When I first came to the health sciences faculty, I was so excited because I was just ready to become a doctor. I was ready to see it all and do it all and become. So for me, I had all these plans, I had all these ideas of where I wanted to be and how I wanted to do things. And I had all these preconceived ideas. And one thing that I've learned in med school is that life is so unpredictable, and everything is not the way that you think it is. Nothing is as it seems. So you need to be able to adapt. You need to be able to move. You need to be able to keep yourself ready for change, because change is often very exciting, very exciting. Medical school will change you, and you should be ready to be changed. I was not the woman that I am today when I first arrived here, and I definitely will not be the woman that I am today when I leave medical school.
How I moved on from the first experience is that when I understood that I'm not generations, It's not by mistake. It's not by luck. It's through hard work and determination.
As the weeks and the months rolled by, and we had chemistry, and we had physics, and we had all these things which I didn't really feel fit in to my views of what medicine and studying a medical degree should have been, I started to question whether I really did belong. I started to ask myself whether this degree, like, was this the degree for me? Is this what I signed up for? And it really took a lot of introspection and a lot of patience with myself, because I had to consistently remind myself that I wanted this and I chose this. And I must say, the patience was necessary, because you do sometimes find yourself, especially at the beginning, because you do chemistry, like pure chemistry, you do like pure physics with forces and torques and things that you'll ask yourself, where am I going to use this in my medical career? And it's just, for me, I felt as though it was just one of those tests that I just had to pass through, one of those hurdles I had to jump over to become a doctor. And I really do feel that medicine, this degree, does build your resilience. You know, each and every step of my journey was definitely worth it. And I feel like UCT really shapes your journey in such a way that you may not see where they are going with this, you may not see where they're going with your education, where they're going with molding you, but when you look back, you realize, oh, that was actually where they were going with this. That is actually why we did this. And it's been such a beautiful, beautiful ride. It's been such a unique experience, and I've enjoyed every single moment and learned so many things, not just about myself, but about other people. And definitely, I will become an excellent doctor because I had this experience.
The mere fact that I was in UCT showed me
Guys,
that
we
I
need
truly...
to wrap up, please, because we still need
It was
time
hard.
for
Yes, to adapt is hard. But if you believe in yourself, and if you keep pushing, like I did, you will definitely find it.
All right, I think that is about it. Okay.
Thank you.
All right, so we hope you enjoyed. I think that is it from us. Generally, we put everything that we need to put in that video. Yes.
Thank you so much to the students for that inspiring little video, and to our other speakers. My name is Dr. Siobhan Gordon. I'm just moderating some of the questions. And I want to bring two up that I don't think have been responded to yet. This is for, the first one is for Dr. Begg, which was about how teaching is going to be conducted in 2021, given that COVID is still potentially going to be an issue.
Thank you very much. So for the 2021 academic year, as UCT will be making sure that we comply with COVID guidelines so that we don't contribute to the epidemic. And what we will be doing is ensuring a blended learning approach. So no big lectures will take place in big lecture theatres, but in person. So those kinds of big lectures will take place in an online format, but we will have in-person teaching and learning taking place in small groups. So clinical teaching and small group learning will happen, dissections, practicals, laboratory work, etc. will take place, but big lectures of over 100 or more will not be taking place in person. Those will happen online. Thank you.
Okay, thank you for that. And then the other question, I mean, I think the students have already alluded to this, but there was a question about what have your biggest challenges been in your 3 years so far. You did speak about that in your video, but I don't know if either of you wants to maybe add one more thing to the challenges that you've had.
I think for me, the biggest challenge was definitely just finding myself and finding who I was in this space and just figuring out what it is that I want to do, you know, because I came in with so many plans. I want to do sports, I want to do this, but then you find that with the time that you have, it's often limited. So you need to find who you really are and then just chuck all the other stuff out and just really focus on your journey.
That is brilliant life advice, Sinalo. Okay, I'm just looking at some of the other questions. There was one about, is it possible to transfer from a third year in another university to UCT? Sandra and the team, or Karen, I don't know if you can respond to that.
Sure. So transferring from other degrees, we need to have a look at your program. Generally, because we start quite early on in the MBChB curriculum with professional courses, you won't have done those in any other degrees, and so generally you would start again in first year. There may be some opportunities to receive some credits for some specific courses, but for the most part, students, tertiary applicants, would start in first year. Thank you.
And if I can just add to that, can you hear me?
Yes,
so
hi Lionel.
Just a very quick answer there, Siobhan, about if you're in another medical program elsewhere, those would have to be on a case-by-case basis, but programs are not similar across the country, so each of them would have to be handled for particular reasons and quite significantly, usually compassionate issues. But it's very difficult to transfer in South Africa.
Okay, thank you. We've still got 1 or 2 more minutes. There's a question here about, am I able to write the GEMP exam at UCT? I think that's no, but anyone from the team, Sandra or Karen, can you answer?
So let me just answer that from a WITS perspective. The only university that's got a program is WITS, a graduate entry program. And you may be able to pick up courses for non-degree purposes here that help you for that test, but the test can only be written at WITS because it's set for WITS based on their incoming competencies they expect you to achieve. But I don't think you should go there. If you haven't got a degree yet, you should come here.
Like you did, hey.
Indeed.
Okay. Okay, well, we've just hit 6 o'clock, so I think I'm going to close the session. There is an email address up in the announcements for any further queries that any prospective students may have, and that is FHS-UG-admiss, that is ADMISS, at uct.ac.za. And I think we'll peace out unless anyone has anything burning to say.
So perhaps just to add to the colleagues, we will endeavour to continue to answer the questions that have come in and make sure that you get those answers. And this will be available as a video on the UCT websites over the next week or so. So we look forward to welcoming you to UCT, and please be patient with, we need to wait for those results. And we look forward to welcoming you next year. Thank you.
Thanks, Dr. Beg. Signing out, everybody.